As we initially received vaccine, as many of you know, the initial doses were reserved for residents and staff of long-term care facilities and then the healthcare workers. And so you're sending a lot of doses to hospitals. They were working through their key staff and doing that well. But we told all the hospitals, look, you're going to do that, that's important, but we need to be ready to go into the community, particularly vaccinating our senior citizens. And that is going to be our priority when we're talking about the broader community. And so one of my agencies, the ACA, urged the hospitals to submit and execute plans for how you're going to vaccinate the seniors in the community. And we've had great response. You're seeing a lot of wonderful things happening just this week, and here today is another great day. I was at Orlando Health earlier in the week. They have 6 different sites across Central Florida. Jackson Memorial Major System in Miami-Dade has 3 different sites. You know, they are doing thousands of shots a day just within their hospital system for seniors in the community at this point, and that's going to continue to ramp up. Today, I think, is really exciting because we're able to announce 2 new vaccination sites that will be run by Ascension Sacred Heart Hospital, one right here at Pensacola's Olive Baptist Church and one at the Milton Community Center. Sacred Heart has completed vaccinating their frontline healthcare workers, and they've answered the call to stand up and help our seniors in our communities, and this is exactly what we want to see the hospitals doing. And you look that line, people are excited. They have a very good setup in there. Now I've been doing this, I've been watching these shots for weeks now, so they were telling me what I was like, oh, I know what that is. They got to wait afterwards and this and that, but they did it. It's very efficient, very good, and I think it's going to be great. But and you'll hear kind of a little bit more about it, but they're locked and loaded to do 1,000 a day for the next 2 days here and at probably the other location. When they asked for more vaccine, we made sure that was something that was done. The reservations for these sites are for individuals 65 years of age or older and are available by appointment only, but I think that all the appointments have already been filled up. The good part about the operation is that you have a great partnership in the community on display here. Sacred Heart is providing the key medical personnel to administer the shots, but the community is providing 30 volunteers, and the Milton Community Center and Olive Baptist Church, of course, are providing their spaces. And so I think this is a model of how this can work, particularly as we do these early doses for our vulnerable population. So I want to thank Sacred Heart. I want to thank Santa Rosa County, Milton Community Center, Olive Baptist Church for their willingness to step up and help their community in the time of need. And we want to continue to see this going on throughout the state. These hospital-run vaccination sites are part of our next steps in order to reach our seniors throughout the communities. Hospitals served as the pillars to our strategy since we were first to receive the vaccine, but we also know we want to expand the reach just beyond the hospitals. When there's ways that we're able to make a difference, we're able to do it. To that end, yesterday I announced the launch of a pilot project with Publix. So at 22 pharmacies in 3 counties, Citrus, Hernando, and Marion, people will be able to go online, make a reservation, and go and get shots at their Publix. And there's a lot of folks some of the hospitals are having people go in the hospital, which is great. There's some folks that just don't want to go into the hospital, but they are going to grocery stores. And so if you're able to get to the grocery store, you can get that done, and that's a really, really good thing. So that is going to start tomorrow with the reservations. Shots in the arms will start on Friday. That is something that we're going to be monitoring very closely because we believe, if that moves smoothly, that's something that we can be able to expand throughout the state, particularly as we get more vaccine. Publix has over 750 pharmacy locations in their supermarkets, and you find it in all corners of the state. I also announced today that the state is going to be converting, or I announced earlier this week, the state's going to be converting some of our drive-through testing sites into vaccine sites. And you're going to have an announcement, additional announcement on that very soon. And we're going to look around where that makes sense. Of course, we want to work with our houses of worship. I know there was something, pretty close by over in Escambia shortly thereafter, or on Sunday, did several hundred folks, and we view that as a model as well. We also believe that most folks, there's a lot of demand for the vaccine, but there's still some folks that aren't sure that they want to take it. And when you have community leaders stepping out, showing that they're doing it, a pastor, someone that people trust, I think that does make a positive difference. So we appreciate what we saw over in Escambia, and we want to keep working with folks to be able to do that. What we do on a daily basis through our Division of Emergency Management is make sure the vaccines are going to places that are going to use them in the short term. And so, for example, yesterday there were some hospitals that said, well, we'll probably get through these first doses in 2 weeks. There were some county health departments that said, yeah, it'll take us 10, 14 days to get. We said, okay, you take what you want for these next week, but we're going to get another shipment next week. So we move those to places that need it. So the hospitals that are blowing through, that can do more, we want to be able to give them more. We've also asked for additional, obviously we want to get additional vaccine next week. That'll allow us to potentially expand the Publix program and have even more drive-through testing sites. But what's happening is, as soon as more vaccine is available, we're looking at ways to be able to get that into the community. And at this point, the hospitals have been given enough vaccine for their frontline workers. And I know they are working with folks who are healthcare workers who may not work inside the hospital. And that's true. There's high contact people in physicians' offices, whatever. Most of the health systems are working to get that done, and we think that that's fine. But we also think that as we get more vaccine, the key is let's deploy that to our senior community. Let's get that to those 65 and plus. And I'm happy to report, even though the first 2 or 3 weeks, the hospitals were largely focused on their own healthcare workers, who of course largely skew under 65. As of this morning's report, and this stuff lags, but I think the number's going to grow. The plurality of Floridians that have received a vaccine right now are between the ages of 65 and 74. So it's showing you're going to continue to see those senior numbers grow. The long-term care mission continues. We're putting additional resources to supplement CVS and Walgreens for that. But that's really what we're looking to see. Is I want to see the shots to be predominantly in the older groups, and I want, if the 85 and plus is 5% of the population, we want the shots of all the shots to represent higher than that. So we want them overrepresented in the shots, and that's what we're going to be working on as we move forward. We do have 1,000 contract nurses who we're going to be able to deploy. We have National Guard who've been working on a number of ways and are going to continue to help, whether it's with these new test sites or the new vaccine sites. As the vaccine comes available for that, we want them to be able to do it. Of course, as I mentioned, we're doing more with the assisted living facilities. The fact that they do have the contract with CVS and Walgreens, they are going to facilities. I know that a lot of nursing homes have been really pleased to be able to get their residents vaccinated. We're actually, this week, you're going to have the initial residents are getting their booster shots. When we did our first 100 nursing facilities, we had the state teams go in and do those until CVS and Walgreens was ready. So they're going to be getting their Pfizer booster shot this week. So their series will be complete, which I think is really, really exciting. But we do want to make sure that all these assisted living facilities are going to be able to get done in short order. We don't want this to drag out. So we've seen maybe a gap. And so we're deploying resources to help fill that gap, and I think that that'll be really, really good. Anytime we do a state site, if we do a drive-through, as long as there's vaccine available, my directive is to just stay open 7 days a week. I mean, what we don't want to do is you have 1,200 doses possible at the end of Friday, and then you say, okay, we'll just see you Monday. If those doses are there, be open Saturday, be open Sunday. So when we open some of these drive-through vaccination sites, the charge is going to be, how many can you do a day? and you're going to do that 7 days a week. And I think that that's important. It'll help boost the numbers quicker. So we are continuing to make a lot of progress. I was talking with the White House this morning about saying, look, we're getting to the point where we've got a lot of things in place. We're in the community. There's high demand. These shots, I mean, you see the number of people lined up. You know, the shots are really going to continue to increase. And so the question is, we want to make sure that if we have other avenues, that we have vaccine that can go to those. So, but it's a good situation to have compared to a couple weeks ago when, you know, we're Christmas, New Year's. Now people are saying, hospitals say, send us more. We want more. We think we can do more. And so I think what Sacred Heart is doing is great. We hope other places around the state will take a look at how they've done it. And, you know, people in there are very happy. I think they're excited to be able to be at this situation. And look, we're happy to be able to support the efforts. I mean, if you are working hard to provide shots to our senior citizens, we want to be able to direct more vaccine your way. And we're fighting to get even more, and we're fighting to make sure that our seniors are able to get the protection that they need. So I don't know, who else is going to talk? Are we going to have a Sacred Heart?
Yep,
okay.
yep,
So Justin from Sacred Heart's done a great job. You know, we've enjoyed working with him. He's going to come up and say a few words.
Hey, good morning. Thank you. My name is Justin Labrato. I'm the Chief Operating Officer for Ascension Medical Group Sacred Heart. And this is a very exciting day here at Olive Baptist Church. This was actually my home church growing up here in Pensacola. I want to thank Pastor Ted Traylor for letting us use the facilities here to vaccinate the over 65 population, our friends, family members, and neighbors here today, tomorrow, and the rest of the month. We also have a second mass vaccination clinic that's open today at the Milton Community Center. And I want to thank Brad Baker and Santa Rosa County for their help in partnering in that mass vaccination clinic. Between the two mass vaccination sites today and tomorrow, we already have 3,500 reservations. So we'll have 3,500 people minimum vaccinated by the end of tomorrow, vaccinated. So, and we'll schedule additional dates in the near future. So in the future, we're going to have those appointments at getsacredheartcare.com. So when they're available, they'll be on that website. I'd like to thank Governor Ron DeSantis for being here today and for helping bring additional COVID vaccines to the Pensacola area in the future as we continue this mass vaccination project. We have a great partnership, so we can't do this alone. Great partnerships with our local FQHC, Community Health Northwest Florida. They're here. They're helping us with manpower today. Great partnership with our hospital. Dawn Rudolph is here today. Ascension Sacred Heart Hospital, the premier hospital for the Pensacola area. Don't delay care. They can take care of you safely. And then finally, I want to thank my amazing team at Ascension Medical Group Sacred Heart. There's been a lot going on this year. We opened up the first drive-through COVID testing center in March, and we've seen 62,000 people there. That's great that we can COVID test, but it's all about the vaccine. The vaccine is the only way that we're going to make a dent in this. So we're excited about these future dates. A couple of people I want to thank, the 100 volunteers today. I want to thank Jacob Fisher, who's leading the Escambia County vaccination effort, Amisha Gurjal for Santa Rosa County, and Jennifer Henry as she led the associate vaccination clinics. So we truly have the best team in healthcare. And I'm going to turn it to Ted Traylor. Thank you, sir.
Hey, thank you, Justin. We're honored here at Olive Baptist, try to bring our community together. Somebody asked me, so it must be a miracle of God you got the Catholic and the Baptist working together. I said, amen, that's a good day. So we got folks together today, and you can see the line, these folks that are servants, our community that are here. And Governor, thank you for all you're doing to help us get this done. Justin as well. Jake, thank you. And it's just a good day when we can reach out and try to help our community. And glad to see this line growing through here, and we're honored here at Olive Baptist to just be a part of that. Thank you, Justin.
All right, so now what they're going to do, they're just going to do some vaccinations right here on site. So, you know, we've got some volunteers, and so they've already gone through and signed the form and everything, and done kind of what needs to be done at this point. So basically, they're going to get the shot in the arm. And then are you going to have them go back in and just sit in the place? So, you know, they have a place inside. When you guys look at it, it's you know, just in just a bunch of chairs. People sit, and all that just for observations. There's been have you guys had any reactions yet for the vaccine? So there've been very, very few nationwide even, but I think they're doing the right thing. You want to be, you just want to be careful. I mean, it's just the way it goes. You guys ready? All right.
Yeah. All right. Not that bad.
And how long did it take to settle out?
2 hours. Yep. Yeah, the system now, as soon as it opens up, because we have all the websites connected, they'll be gone within hours.
What's that? Okay. What is it in the 40s right now, you think?
This morning it started on 40.
What is it? 46. 46?
You hit it the right time.
All right. Did you feel anything?
Hey, brother.
Is this Moderna or Pfizer?
Moderna.
All right. Done?
Not yet, not yet.
Oh, well, there it is. Okay. All right.
Good job, Denise.
Good job, guys. See, if anyone was thinking about whether they want to get it, see how easy it is, and it's like these guys, not a problem. I'm gonna also, I just want to introduce real quick CFO Patronis to come say a few things.
Governor, can we take a picture?
Take a picture? Sure. Look at it.
That's awesome. That's good. All right. Okay, 1, 2, 3. Here's one more. Good job.
All right.
Now y'all have to share it.
Happy New Year to you. Yeah.
There you go. Let's go this way.
Yeah, thank you.
We'll sit down for 15 minutes.
Thank you all. Thank you, Governor, for what you're doing. As most of y'all know, I'm a Panhandle native, born and raised in Northwest Florida. I couldn't be prouder of everything Governor DeSantis has done to lead in this effort. I'd like to thank the team at Ascension Health and as right here at Baptist Olive Church and what they have done in order to put resources together at a moment's notice to get this vaccine out. Today, they will pump out right here alone over 1,000 vaccinations. They'll be able to do the same thing over at the Milton campus and to bring 1,000 people in. Organizing the appointments is short of miraculous to be able to put this together in such a quick turnaround time. But as we've been traveling the state over the last several weeks, we've been meeting with legislators, business leaders, and we've been hearing their concerns, their needs, but also pointing out the advocacy that we need to tell the legislature that we need COVID liability protection for our businesses. And not just our businesses, it's for our non-for-profits and our healthcare providers. It's critical that we see this happen this coming legislative session. Governor DeSantis has been working tirelessly to push the vaccination out, to see it firsthand, and if it means going to every single corner of the state to ensure that this is part of a smooth flowing process, that our citizens are being protected, that's exactly what he's doing. So from the bottom of my heart and from my family, thank you, Governor DeSantis, for what you're doing and putting people over politics and ensuring that the state's economy is being protected. I know there's it's a big deal. I know there's a limited supply, and as Governor DeSantis, thank goodness he has had the relationship he has had to be able to ensure that Florida continues to see a steady supply of vaccinations. And as he sees that, he empowers those areas to get out there and put boots on the ground, making partnerships, just like the preacher said. We're bringing Catholics and Baptists together to save lives. Isn't that a great thing? But as we're taking and being innovative, people go to grocery stores because they go to grocery stores. Well, let's go ahead and get them their vaccination at the same time. Partner with Publix, you know what? That's a great idea, but it wouldn't come together if you wasn't seeing the leadership from our own governor. So, Governor, thank you for everything you're doing. Thank you for saving Florida's economy, and thank you for saving our people. God bless.
Appreciate you. Just let me thank Sacred Heart Pensacola, not just for doing this, but really for how they've handled this entire pandemic. I think they've done a great job. When we needed more testing here, we obviously provided some resources to them, but they were really leading the efforts on drive-through sites and all this other stuff. We work closely with the local counties here as well, and I really think that it's been a model. So thank you for all you've done. I think this is just continuing, and I think you're going to see. I mean, they told me of these first few thousand appointments that they were reserved within 2 hours of this being made public, and so the demand is strong, and we're going to work to make sure that supply can meet it. Now, I think what will happen as we kind of continue on is, the demand will start to be met, so the demand will go down a little bit, the supplies will start to go up, and that means we're going to continue to look for more innovative ways to be able to deliver this to the people, particularly the people who need it most, our senior citizens. Any questions?
Governor, do you believe the state needs to take a more centralized approach in rolling out this vaccine? I've seen you strengthen some of the different aspects of the rollout, including adding more nurses and adding more pilot programs, public.
Well, so we obviously are leading the effort in terms of, one, setting the priorities. So if you remember, a few weeks ago, the CDC's advisory committee was going to recommend that seniors not be eligible for the vaccine at this point outside of a nursing home. They were going to say do essential workers. Now, those essential workers, first of all, I don't like that essential because I think everyone's essential, but they are at much less risk than elderly people. There was a lot of blowback to that, and so then they said, okay, do essential and then add 75 and plus. problem with that is, from an administrability perspective, I think that'd be a nightmare, and you'd have people who are 73 not even eligible for a vaccine, and you could get somebody who works, at a supermarket, a 20-year-old would get it. So we stepped in and said, not in Florida. We're putting our seniors first. Yes, we're going to do healthcare workers. Yes, we're going to do nursing homes, which we were the first state to do. But we've got to offer it to 65 and plus. And so that's what we did. So everyone had their directions on that. And we also provide the support as it goes by. We are also taking an active role in making sure the vaccine is distributed in places that are using it most effectively. So we have pulled back from some places. If they tell us they can't get it all out for 2 weeks, we know we're going to get more vaccine next week. So we take that and then we do it. And I think that they've done a really good job of doing that. But I also think what you don't want the government to do is to try to displace our healthcare infrastructure that we have here. They know what they're doing. They know how to deliver this. And it's not only the hospitals. I mean, we have county health departments that are in the fight. We have these drive-in sites. You're going to start to see more and more of those. We're working with Publix to be able to do it. But that's really a better delivery mechanism than to have everyone kind of go through the government or have the government in a situation of having to do it. And I think you're going to see that. I mean, this is scaling up. You're going to start to see it. The hospitals are in a good stride now. Look, at the end of the day, when you get a vaccine dropped on your doorstep right before Christmas, which is almost every hospital got it right before Christmas except for 5 who got Pfizer the week before, that's not the best time to get it in terms of staffing and everything like that. And so we understood that, but we made the challenge. Get into these communities when you're done with your healthcare workers. I think that most of the hospitals have finished that, and then they're answering the call. And so I'm excited. You're going to see this all over the state very, very soon. And there's going to be a lot of shots going into arms. We'll do way more shots this week than we did last week, and we'll do more shots next week than we do this week.
The biggest concern we're hearing from our viewers at this point is the registration process, and I acknowledge that's a little tactical for your perspective, but we're getting to push the register online. If in one instance for one of our counties there was not even a phone number available for 24 hours. Forgive the stereotype, but you've got a population that probably broadly has the least technological savvy and the least technological access. Are you aware of these concerns, which have been flooding our newsroom, and is there something from the governor's office that can affect at least a cultural shift to make it accessible and realistic for the folks who are trying to get registered?
No, look, so it's an absolutely valid concern. I mean, you have a situation, and we said this from the beginning, we have 4.4 million people that are 65 and over. We do not have 4.4 million vaccine. We don't even have 1 million vaccines sitting around at this point. So the demand is going to outstrip supply. This was reserved in 2 hours. So if you didn't know what was going on right now, you go 5 hours later, you can't do it. So we understand that. I think most of the hospitals have worked through some of their registration issues. I know we've had it in other parts of the state. In every instance, they've made accommodations. What we are doing, though, in the state, and I've directed for at least the county health departments and any state-run sites, we're surging additional telephone folks, so that, because you're right, I mean, some people just want to talk to somebody, and maybe they don't know internet as much as we think that everyone does. So that'll be happening. So on these drive-through sites, if they're in partnership with county health, there'll be additional phone resources to be able to do, and I know some of the hospitals are doing that as well. Publix has a great online system. We're going to see how that works, but I've also said, look, if we scale out Publix statewide, what's the capacity for taking phone calls? I mean, obviously they have other stuff they have to serve their customers, but that would be something that would be, helpful for some people. So I think it's a totally valid concern, and we're working on helping people address it. But I also think some of this is just the fact that it's going to take some time to get enough vaccine to meet the demand. I don't think it's going to take 3 months, but I think every week we'll get more, and then more and more people will be able to do it. So if you couldn't get a reservation here today or tomorrow, just understand there's going to be more opportunities, and we want to bring that to the community. Absolutely. Yes, sir.
Governor, as the vaccine rolls out and we're fighting back against this pandemic, cases here are still going up. We're seeing high positivity rates. The mayor of Pensacola sent your office a letter asking for more local control over efforts such as mask mandates and enforcing those. Did you receive that letter, and any thoughts on kind of
we will categorically not allow any local government to lock people down. We will not let any local government kick anybody out of their job. We will not any local government fine individual Floridians. We will not let any local government shut down schools. And we're not going to let any local governments do those things. So, you can advocate for certain stuff. There's certain businesses, obviously they're doing whatever, but mandates, lockdowns, fines, we're just not doing that. They are not effective. Let me tell you that right now. You look around the country and see some of the areas that have had the most draconian restrictions, and you're seeing really, really bad results. It doesn't work. We got to trust people, give them the information, ask that they use common sense. And I will say this, though, I was just down in South Florida at Jackson Hospital. And it's true, the positive tests are higher than they were 6 weeks ago, and actually higher than even the summer, which is really when we had our epidemic spike. In Jackson Memorial, the biggest system down there, their COVID positive patient load is less than half of what it was over the summer. So the positive tests, at least there, are not driving, a massive hospitalization. Now, I think in some other parts of the state, you'll see a little bit different with hospital admissions because some places didn't get hit as hard as Miami, and so I think that that's due. But what I think this is the most effective tool we have to battle the pandemic. I mean, if we continue to vaccinate senior citizens, you are going to reduce the ceiling for hospitalizations. You absolutely will, because those are the folks who are most likely to get hospitalized. You will reduce the mortality rate, because obviously the mortality's been so concentrated in the 65 and plus. So this is why we're really focused on this. And I think that it'll be something that's going to really make a difference. And I think hopefully you'll see it, relatively soon. In terms of the difference it makes. But that's really what I look at. I mean, if there's positive tests, I look at, okay, are those positive tests in 20s, 30s, or are they in elderly? And then the same with the vaccination. Okay, are we getting 65 and up vaccinated? And you're starting to see that in the numbers. I think that'll be more dramatic very, very soon.
Last question, Governor, I'm curious what you think about these reports we're hearing out of West Palm about a nursing home giving out vaccines to wealthy donors, and whether or not you think that's acceptable, because there's some serious concern that this is violating state code or potentially some of the...
Yeah, I'm not sure about that. I mean, the nursing homes, the state did 105 nursing homes the first week because CVS and Walgreens hadn't ramped up. And then CVS and Walgreens, they're contracted with the federal government. They're going to a lot of these facilities, vaccinating the staff and residents. And then we are now going to do more with the assisted living facilities. Now, we have sent vaccine directly to some of the nursing homes in places like Miami-Dade because they have the capacity to administer it. But my understanding is they're administering that to their, to their residents, which is very appropriate for them to do. So, all right, well, we'll be back soon, and we're going to have more stuff going on up here in Northwest Florida. Thanks.